Hello, my name is Natalia Leonidovna Nakorik. I am a dentist and I work at the Palmyra MaxMed Dental Clinic. Today I want to talk to you about a topic that affects everyone in one way or another: wisdom tooth extraction. So let's first figure out what types of aids there are. Wisdom teeth can erupt normally, be part of the dental arch, and perform all the functions of chewing teeth. But nowadays this is very rare, since wisdom teeth have become vestigial. Wisdom teeth can also be displaced or abnormally positioned. Such teeth are most often prone to cavities due to their location. But it can be much worse when cavities from neighboring wisdom teeth spread to the second molars. Because of the location of the cavity, it is hard to notice, and the patient only comes in when something starts to hurt. Wisdom teeth can also be impacted, meaning they are hidden deep beneath the gum. Impacted wisdom teeth are insidious. You can't see them, but that doesn't mean they can't cause harm. In fact, they are the ones that most often provoke crowding of the teeth in the front areas, and most often they are removed for orthodontic reasons. Diseases such as cavities, pulpitis, and periodontitis are the main indications for removing wisdom teeth. Very often, wisdom teeth are prone to cavities, and if the tooth is displaced, that is, turned to one side, it is very difficult to reach, and it's very hard to isolate the working area with a rubber dam. Consequently, the treatment will be of poor quality, so it's easier to simply remove such a tooth right away and not worry about it. So let's figure out how the extraction process begins. First of all, it starts with anesthesia. For the patient, this is the most unpleasant stage of the entire surgical procedure. But there's no need to worry or be anxious, because the injection site is first treated with a special gel for topical anesthesia. It tastes like jam, and I think that would lift any patient's spirits. After the injection is given, the doctor assesses the level of numbness, and then the most interesting part begins: the extraction of the wisdom tooth. When the tooth is hidden beneath the gum, the surgeon makes a small incision to visually assess the position of the tooth. Once the tooth is removed, curettage is performed, that is, the socket of the extracted tooth is filled with a blood clot to prevent inflammation. Then, if necessary, a few stitches will be placed, and you'll be sent home to rest for about a week until your next checkup. After wisdom teeth removal, it's important to strictly follow the recommendations. Under no circumstances should you rinse or apply heat to the area where the tooth was removed, because it's crucial to preserve the blood clot in the socket. Secondly, avoid eating for the first 2 to 3 hours until the anesthesia wears off. Otherwise, you might accidentally bite your lip, cheek, or tongue, which is quite unpleasant. If necessary, you may also be prescribed antibacterial and anti-inflammatory therapy. Or if you experience pain, you may be given a painkiller. Usually this is Nimesil. But you shouldn't overuse it. You should take no more than 3 packets a day. It is very important to start doing salt rinses on the second day. If you are traveling or at work, take a bottle of hypertonic solution with you. This is 1 teaspoon of salt per glass of room temperature water. And after every meal, you need to rinse the socket, thereby removing any food particles. During the rehabilitation period, you should avoid eating hard or spicy foods. It is also important to continue maintaining oral hygiene. If you have had a tooth removed, that does not mean you should stop brushing your teeth.